Hello everyone. Today I have the pleasure and honor of welcoming with me one another NEET PG top ranker, Dr. Viren Rohra. He has secured rank 33 in NEET PG 2023 examination all over India. Awesome performance. Congratulations, Viren.
Thank you. Thank you so much, sir. It's been an honor of joining DAMS and then doing all the courses and then finally getting such an amazing rank and getting an interview with you. So yeah, it's
Great.
like a dream come true.
It's a pleasure for me to talk to you. अच्छा लग रहा है मुझे that you are talking to me and it's a pleasure. Tell me about yourself, Viren. Where are you graduate from?
So sir, I did my MBBS from Topiwala National Medical College and Nair Hospital, Mumbai. I'm from 2017 batch. I'm currently an intern. And yeah, this was my first attempt. And
Great.
I joined DAMS in my third year minor in the foundation course.
What was your score in this year NEET, Viren?
So my marks were 691.
691. Very good. You are even more than 85%, almost 85%.
Yes, sir.
I don't think so. You have got 85% ever in your university MUHS.
No, sir.
And you got 85% in NEET. So technically, it is the best score of your MBBS.
The best score of MBBS, best score of like internship also every best GT ever.
Best GT ever. Best GT is the real exam. Great. So honestly, tell Viren, when did you actually started preparation for NEET PG?
Sir, I started in my third minor. I took the foundation 3 years course. So initially we had a few offline lectures, but after that COVID and lockdown hit, so our lectures got shifted online. So at that time I was actually a bit apprehensive because DAMS was known for its offline face-to-face classes. But I would like to thank you, Dr. Sumesh sir, Dr. Deepti ma'am, and the entire DAMS team for like the smooth transition to online lectures. So I think really utilizing those lectures well in my third minor has been the key to my success.
So what exactly did you study in third minor? Because there are a lot of third year students who are, looking forward to you and watching your videos with this video. Suppose there's a Nair junior of yours, you are 2017 batch, he's 2020 batch, and he's looking forward to you, hear from you. How should he start in reading in third year? What should he study?
Sir, so I think third minor should be the ideal time to start PG preparation. Before that, I think one should focus on concepts and reading standard books. I think that's better. So from third minor, actually, there was a lockdown. So that benefited me a lot because all I had to do was sit home and attend lectures and make notes. Otherwise, I think along with the college lectures, it would have been a bit difficult. So in my third minor, I made notes of all the subjects. Like the DAMS team amazingly covered all the subjects in a span of, I guess, 10 to 12 months. So I made all the notes of those subjects, maybe even revised a few subjects once or twice. And then I focused more on my the third minor subjects like ENT, Opthal and PSM for my university exams. So then when I entered final year, actually due to a lot of university exam postponements, we had only 5 to 6 months of final year. So that time I could not focus much on other subjects. I just focused on final year major subjects like surgery, medicine, OBGY, PEDS and a few short subjects. So then in internship, I took the DAMS TND and that also benefited me a lot because it gave me fixed targets. There were weekly subjects. So I had to complete those subjects in a week and give the TND. So it helped me keep on track.
Great. So how did you utilize TND?
Sir, so actually I saw a video of yours like during the starting of TND. So you had said that after giving a TND, we should review it. And then before a TND also, we should review the past year questions and do the Q bank. So I followed that strategy only. So I attended the TND online. Then I made the notes, or sometimes I added extra points in my existing notes of third minor. So then the next day I revised the main points of the TND of the previous subject, and I gave a time of about 5 to 6 days to prepare for the next subject.
Okay. Okay. So were you able to keep up with the pace of the TND? Schedule was finishable along with the internship?
Sir, it was a bit difficult, I guess, for a few subjects like medicine or surgery. I was behind the schedule, but I think the TND got over sometime in September. So after that, I managed to cover the backlogs.
Okay. Okay. So how did you plan your revisions after the TND was over?
Sir, so after the TND was over and all my backlogs were covered, I think it was by mid of November or first week of November. So by that time, my first reading was over, and then I managed to target at least 2 revisions because I knew that I had to revise the content. Otherwise, I won't be able to remember it on the exam day. So from 1st of November to I guess second week of January, I did my first revision. Then from January mid to February, I did my second revision. And in the last 10 days, I did my final revision. And during the revision, I mainly focused on the TND topics. Like during the TND, the teachers had told that these topics are important. So I completed those topics first during my revision. And then I solved some previous year questions also for the respective subjects.
All right. So apart from TND, what else in eMedicoz app did you see and you utilized and you found it helpful?
So there were 2 things that come. First one was DVT, like it was conducted in December, and I was almost at the end of my first revision. So that acted as a boost to me. And in DVT also, the topics which were covered, they helped me revise the subjects very fast. Like I particularly remember your DVT of psychiatry was really awesome. Like in 5-6 pages, you had covered almost all the important points of psychiatry. So during my final revision in the last 10 days, I could complete psychiatry in 2 hours using your DVT and a few bookmark MCQs. So then Deepti ma'am's DVT was also awesome of OBGY. And of course, Umesh sir's radiology session was as always amazing. So then I also utilized the PYQ Kebab session, which was conducted before NEETPG. So it further made me realize the importance of PYQs. And I revised all of the PYQs using that session.
Okay. Any general advice that you would like to give to your juniors who are listening to you in general?
Sir, I would say to be consistent and disciplined is the most important thing in the PG preparation, because during my internship also it was a bit hectic, and I had to squeeze in a few hours here and there. And sometimes I even solved MCQs, only MCQs in a day, but I think that was progress. So one should try to squeeze in as much time as possible during the preparation and stay consistent towards the end. And one last 10 to 15 days, or I think 7 to 10 days revision is a must, because usually in exams they ask factual questions also, like one-liners of actual questions which were asked in NEETPG also. So those questions can only be answered if you have revised properly in the last 7 to 10 days. So I think that's essential as well. And for that, one should use DVT if possible. Like it's a really nice source.
Great. Great. So before we finally end up this video, any person you would like to thank in your family, in your teachers, in your friends who has contributed to your success today?
Sir, of course, my family, like my mom, dad, grandmother, grandfather, they all have supported me throughout my MBBS journey, not only during the PG preparation, but throughout my MBBS journey, they were really supportive. And I would also like to thank my cousins and relatives. They were also, they provided a moral boost during my PG preparation. And of course, my friends from the college, like we had a group of 3 to 4 people, and we used to regularly discuss MCQs and keep updated of each other's progresses. So that was also beneficial for me.
Great. It was great to have you with us, Viren, and we wish you all the best for your future. It was a pleasure talking to you. Thank you so much for being with us. Thank you very much.
Thank you, sir. The pleasure is all mine, sir. It's like a dream come true.
Hope to see you soon. Bye-bye. Take care.
Yes, sir. Yes.